Hello, this is Siddharth, Tambar, Chicago Arthritis. So today I want to discuss an interesting article I read in the New York Times recently. In this article, they discuss how, despite the fact that there are certain very common knee and lower back surgeries that have no evidence of more efficacy than just physical therapy, that these surgeries are still done. It's an interesting concept, because when you start thinking about the benefit versus the risk associated with treatment, you need to rethink how you look at things. This applies to whether you're talking about physical therapy, medication, surgeries, or even regenerative medicine. In the case of knee arthroscopy in the setting of arthritis, or certain surgeries for the lower back, the fact that there's no evidence that these may be more beneficial than just physical therapy should indicate that in the vast majority of cases, when you consider the risks, it doesn't make sense to proceed with some of these surgeries, because you may not get any additional benefit besides just conservative measures. When you then consider that some of the potential risks include infection, blood clotting, cardiovascular disease or cardiovascular events, as well as if you've cut out tissue, you're also increasing the potential risk for progression to arthritis. That risk and benefit ratio would really indicate that it probably doesn't make sense to proceed with that kind of treatment. So a similar thinking process can be applied to regenerative medicine as well. What regenerative medicine processes and treatments make sense when you really think about the risk and efficacy evidence out there? There are certain treatments, such as amniotic fluid and umbilical cord fluid, where it probably doesn't quite meet that evidence to really proceed with this kind of treatment compared to some of the other treatments that are available. For example, with amniotic fluid and umbilical cord fluid, these are treatments that have been shown to have no live cells. So right off the bat, these are treatments that really aren't exactly doing what they claim to be doing, which is a stem cell treatment. Number two, you're talking about third-party source products. They're not coming from yourself. There's some potential issues with infection as well. You have to consider those. So you have something that probably doesn't quite meet the efficacy standpoint, and you have something that may have some additional risks that are unique to that specific product. It doesn't really meet the risk to benefit analysis in my view. On the other hand, the regenerative medicine treatments such as platelet-rich plasma and bone marrow-derived stem cells that have been around for over a decade, 2 decades, where there's an accumulated body of evidence that these can be efficacious in the right cases. In addition, because they're low risk, because they're sourced from you as well, that risk to benefit analysis should more favorably favor a proceeding with treatment. If you then take it to the next level, which is if you have a physician that happens to work within a network of other physicians, of utilizing procedures and consistent processes of how they procure cells, of how they prep cells, and of procedural elements, and also how they even follow patients long-term in terms of data collection, it then makes more sense that that's a set of treatments that may be more efficacious, where there's more measured and balanced risk as well. You then really put that regenerative medicine treatment at a different level, where you can then say, evidence suggests that not only can this work, but here's the data, here's the risk data associated with it as well. It makes more sense to consider that kind of treatment. Thank you for your time. Leave me your thoughts. Appreciate your listening, and have a good day and live well. Thank you.